How is plasmacytoid urothelial carcinoma different from other bladder cancers? Imagine a type of bladder cancer that looks a bit like immune cells under the microscope and behaves more aggressively than typical bladder cancers. That's what plasmacytoid urothelial carcinoma is all about. It's a rare and very invasive form of bladder cancer that differs quite a bit from the more common types. To understand how, let's start with its cellular appearance. The cancer cells in plasmacytoid urothelial carcinoma resemble plasma cells, which are immune cells that produce antibodies. These cells have an eccentric nucleus and lots of cytoplasm, giving them a plasma cell-like look. This is different from the usual urothelial carcinoma cells, which tend to look more like the transitional cells lining the bladder. Another key difference is that plasmacytoid urothelial carcinoma often shows a loss of a protein called E-cadherin, which helps cells stick together. Losing this protein makes the cancer more invasive and prone to spreading. This type of bladder cancer is also much more aggressive. It tends to be diagnosed at a later stage, often invading deep into the bladder and sometimes beyond. Unlike typical urothelial carcinoma, which can sometimes be caught early and treated successfully with less invasive methods, plasmacytoid urothelial carcinoma often requires more radical treatment. It has a higher chance of spreading to nearby lymph nodes or even to the peritoneum, which is the lining of the abdominal cavity. Because of this, the prognosis is generally poorer compared to other bladder cancers. Diagnosing plasmacytoid urothelial carcinoma can be tricky. It doesn't always from the typical papillary or nodular tumors that doctors look for in bladder cancer. Instead, it can grow diffusely, making it harder to detect early. This infiltrative growth pattern can sometimes delay diagnosis and treatment. When it comes to treatment, because of its aggressive nature, patients often need a combination of radical surgery, like removing the bladder, and systemic chemotherapy to try to control the disease. Standard treatments used for more common bladder cancers might not work as well for plasmacytoid urothelial carcinoma, so early and accurate diagnosis is crucial. Comparing it to other bladder cancer types helps clarify its uniqueness. The most common bladder cancer is urothelial carcinoma, which usually presents with papillary or flat growths and tends to be less aggressive if caught early. Squamous cell carcinoma, another type, arises from squamous cells and is often linked to chronic irritation or infections. Adenocarcinoma is rare and develops from glandular cells, often associated with congenital issues or long-term irritation. Small cell carcinoma is very rare but highly aggressive, originating from neuroendocrine cells and typically requiring chemotherapy and radiation. What sets plasmacytoid urothelial carcinoma apart is its distinctive cell appearance, its invasive growth pattern, and its tendency to be diagnosed at a more advanced stage. In summary, plasmacytoid urothelial carcinoma is a rare, highly invasive subtype of bladder cancer that looks different under the microscope and behaves more aggressively than other types. Its unique cellular features and tendency for early spread mean that it often requires more intensive treatment. If you or someone you know is facing bladder cancer, it's essential to work closely with healthcare professionals to get an accurate diagnosis and personalized treatment plan. Always remember that individual experiences can vary, and medical advice should come from qualified specialists.